Hi all, this is Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I'm going to talk about a functional training in neurogenic bladder dysfunction. So this is a neurological approach. So to start with the understanding of neurogenic bladder, I will be discussing about the prevalence and impact of it in neurology. So neurogenic bladder is a common neurological condition. So conditions like multiple sclerosis, spinal cord injury are the most common cause of the neurogenic bladder. So prevalence estimates that some millions are affected globally with the neurogenic bladder. So it varies significantly by the underlying neurological condition. So it often requires a long-term management and also a lifelong management can do. So the next thing is impact on life. So patient faces a urinary incontinence or a retention. So this will lead to social isolation and reduced independence. So it will be preventing the person from participating in the social activity. So it also increases the risk of infections because of the bladder dysfunction, so that the kidney can also get affected with the neurogenic bladder. So here is the etiology and classification of the neurogenic bladder. So the etiology is basically the statement itself says the neurogenic bladder is of neurological origin because of any of the neurological pathology which affects the bladder. So to classify the bladder dysfunction, it is of two types: upper motor neuron lesion and lower motor neuron lesion. So upper motor neuron lesions, conditions like spinal cord injury above S2 level. So it results in hyperreflexic bladder. So the symptoms in hyperreflexic bladder are urgency and the incontinence. So the next is the lower motor neuron lesion. So it involves damage to sacral spinal cord or peripheral nerves. So that causes the flaccid bladder or underactive bladder. So symptoms of this flaccid bladder include retention or overflow incontinence. To simply state that upper motor neuron lesion causes urgency and incontinence, and lower motor neuron lesion causes the retention and the overflow bladder. So how we can currently manage this paroxysm from medical to interventional therapy are discussed in this slide. So the treatment for neurogenical bladder, in case if the bladder is failed to empty, so what are the treatments are recommended? The first thing is behavioral modifications like pelvic floor exercises which enhances the bladder output, and the intermittent catheterization to remove the bladder urine. So the next is the botulinum toxin A injection into the sphincter. The other one is the suprapubic catheter method and indwelling catheter method. And sphincterectomy and urethral stent can be used, and urinary diversions can also be done to empty the bladder. So in case if the bladder is failure to store the urine, what are all the things we can do? The first thing is lifestyle modifications like diet and fluid intake, and timed voiding method is strictly followed in this case. And the anti-muscarinics medication, botulinum toxin A injection into the dextrosor muscle, indwelling catheterization, and reconstructions can be done in this method. So in case of pharmacological treatment, so it will help to control the bladder muscle activity. So the muscles which are used in the bladder control will be maintained properly with the help of pharmacological treatment. So anticholinergics to reduce the overactivity, alpha blockers which will improve the bladder emptying can be used. Next, catheterization. What is the use of the catheterization? Intermittent and indwelling catheters manage the retention. They prevent the kidney damage. Proper technique is crucial to prevent the infections. So Botox injection. Botox into the bladder muscle reduces the overactivity. So this is for severe cases only. Botox injection will be used. Next, in surgeries which increases the bladder capacity and urinary diversion and creates the new pathway for urine are the commonest surgical options in the management of this neurogenic bladder. So what are the principles which are used in functional bladder training? So which is of two types: re-educational method and adaptation method. So patient education about the bladder function is the key of the re-education, and the patient learns about their specific dysfunction that will empower them for the self-management. So what are the re-education techniques we will be using? Scheduled voiding, progressive adaptation, and urge suppressions can be done. Scheduled voiding, regular toilet trips prevents the accidents. So this trains the bladder to empty consistently. So intervals are gradually increased during re-education. Then progressive adaptation is one of the method in the functional training of the bladder. So the training adapts as the bladder gets improves. So goals are adjusted over the time. So it will give you the long-term effect in this progressive adaptation. So the next is urge suppression. In case of urgency, this kind of adaptations will help you to suppress this urgency. So the techniques to defer the urinations are taught. Deep breathing and relaxation will help. So this extends the voiding interval. So these are all the principles of the functional bladder training exercises. So what are the key functional training techniques? As we know, the physiotherapy plays the main role in the functional training techniques of the bladder dysfunction. So one of that is a pelvic floor training, biofeedback, and bladder retraining. So pelvic floor muscle training or the strengthening the pelvic floor muscle improves the bladder control. Kegel exercise is the most common example of the pelvic floor muscle training. So which is consistent in results in the researchers also have shown that. So biofeedback is a technique that helps the patient to visualize the muscle activity. Sensors provides a real-time feedback. So it enhances the awareness and control of the pelvic floor muscles. Next is the bladder retraining. So this behavioral therapy aims to extend the voiding interval. So patient gradually increase the time between urination. So it helps restore the normal bladder capacity and function. The next is the fluid management. Regulating the fluid intake is important. Avoiding irritants like a caffeine will help you to fluid manage. So that spreading intake throughout the day is a beneficial for the fluid management. So these are all the key functional training techniques in the treating the neurogenic bladder. So evidence and application in neurological population have shown that so the pelvic floor muscle and the biofeedback in the multiple sclerosis cases has reduced the incontinence by 50%. So the bladder retraining in spinal cord injury has increased the voiding volume by 30%. So combined approach of the pelvic floor, biofeedback, and bladder training in Parkinson's disease has shown that there is an improved quality of life scores. So to conclude this, integrating the functional training into comprehensive neurological care will give you a better outcome in treating the neurogenic bladder. So collaboration is key. So multidisciplinary team approach is needed in treating the neurogenic bladder, and also each patients will differ in their own characteristical features of the neurogenic bladder. So tailoring intervention to individual need is must, and each patient's unique challenge should be addressed, and this maximizes the effectiveness of the training. So, and the continuous monitoring is necessary to ensure ongoing progress, and adjustments are made as the condition evolve. So, long-term success relies on the vigilant care. So, to conclude this, so we have to integrate the multidisciplinary approach in treating the neurogenic bladder. Thank you.